Good morning, everyone, and welcome to the Hawaii Health Data Warehouse Coffee Break Monthly Webinar Series. I'm Tanya Lowry St. John, the Public Health Epidemiologist with the Hawaii Health Data Warehouse, or HHDW, and we're going to use the next 30 minutes to introduce you to the Primary Care Needs Assessment Tracker in Hawaii Health Matters, or HHM. The Hawaii Department of Health and Family Services Division has produced a primary care needs assessment data book in Hawaii about every 5 years, starting sometime in the 90s. The edition prior to this one was the 2016, which is displayed here, and each revision has used the latest data and technology to present health data at the community level. So the state is divided into 35 primary care service areas, so it lets you begin to really hone in and get down and not just look at data on a state or on a county level. This data is used by policymakers and many different stakeholders, including policymakers, health planners, healthcare professionals, and community members to assess the relative health risk and primary health care needs of their community. The data has been presented in table and then the most recent version in a more detailed map form to help make it easier for you to see disparities. The 2021 version of the data book has switched to an online format in the form of a health tracker in the Hawaii Health Matters website, or HHM. This tracker is a convenient tool for comparing common health statistics across the 35 primary care service areas in Hawaii, and the tracker includes more than 45 indicators of population characteristics and health statistics, including the population and socioeconomic indicators, maternal and child health indicators, morbidity indicators, mortality indicators, and oral health. And then we're going to be adding a new section on mental health and substance use hospitalization, and that will be coming soon. It's just an expansion of the indicators that were available in the 2016 data. In order to produce stable estimates across the 35 primary care service areas, we've used a 5-year data aggregate from 2014 to 2018 for most indicators. Some indicators use more years of data, and some are not collected every year. The periodicity will be indicated per indicator. The tracker includes data from the census, the American Community Surveys, vital statistics, birth and death data, the behavioral risk factor surveillance system, the point in time count, and also from the LaLima Data Alliance. There are several advantages to the digital format. The tracker allows users to explore trend data, so not just a single point in time as in previous versions, and many tracker indicators include information about subgroup, so information on that indicator by sex, age, race, ethnicity, for example, which allow you to dig a little bit deeper into the underlying patterns of health behavior, not just geography. The indicators are presented with icons to highlight comparison data and directionality, and we'll cover this more in a minute. And the maps and charts in the tracker are interactive, and both can be downloaded to be included into other documents. Lastly, as with all the data in the Hawaii Health Matters, the underlying indicator data is updated asynchronously as each new data source is loaded into the warehouse. So this means you're not going to have to wait 5 years to see updated information in this tracker. Instead, the information will constantly be refreshed so that, for example, when we load the 2019 BRFSS data, we will also update the BRFSS indicators with the data from 2015 to 2019 and so forth. So from the poll, I do know that you are a little bit familiar with the data book, but I did want you to know that we've added several new indicators to the 2021 tracker. And so these are going to include the proportion of the population that's Black or African American, the proportion of the population that's Korean, adults who did not see a doctor due to cost, adults with the usual source of health care. We've added data from the homelessness data from the point in time count survey. Unfortunately, that is only available at the state and county level, but it is a new addition to this, this product. We have information about sexual or gender minority adults, adults who use electronic smoking devices, adults with kidney disease, and adults with prediabetes. To get to the Hawaii Health Matters site, you can go 2 ways. One, you can start here at the HHDW site, so just hhdw.org, and you can click on Hawaii Health Matters here, or you can also just go directly to the Hawaii Health Matters site. Both ways work. This month is easy to find the Primary Care Needs Assessment Tracker because it's part of our featured content. And when you see our featured content, you can click on it. It will take you to the tracker. And as you scroll down, you'll also see that our focus on mini dashboard of the month, which always relates to the featured content, is also about the primary care needs assessment tracker. This dashboard changes monthly, and it highlights information that's related to the featured content. So you can see that we have 4 indicators from the tracker with icons, and we have a link to the tracker itself, a little bit of information, and we actually have a link to the 2016 primary care needs assessment data book if you'd like to see it. As we develop, the executive summary for this is developed, this will also appear so that it's there. But what happens after April and you need to find the tracker? So there's 2 ways to do it. One, you can come up to our track progress, and that will give you a drop-down menu of all of the trackers that we have in the site. And primary care needs assessment tracker is going to be the first one listed right now because it's the most recent we put up. Or if you click on track progress, you'll see here again, you can see the different trackers that we have in the site, and you can just click on primary care needs assessment tracker. The other way is you can go into find data and our community dashboard, and this is sort of the home of all of our data in the site. So you can search by keyword, by indicator, by location. We have a couple of all of our trackers here are located in some other dashboards that may be helpful to you. And you can see here that the primary care needs assessment tracker is there. So no matter which way you choose, and there's multiple ways, that's how we're going to get to the needs assessment tracker. So I'm going to go ahead and click here for now. And this brings you to the home page of the tracker. So this is going to give you a little bit of information about the tracker. We have links to the previous data book, what the purpose of the tracker is, and eventually we will also have links in here to the executive summary as it's approved and released. But it gives you a little bit of background information, and you can scroll down here and you can see that these are all of the indicators that are in the tracker grouped in the same form that they were in the 2016 book. So it starts off with our population and socioeconomic indicators. So you can see we have population data. We have information about the race ethnicity of our population. Then we have information about access to healthcare, insurance, and access to healthcare. We have information about population income, poverty, working, education, going down to information about households receiving assistance and SNAP, foreign-born persons, people within linguistic isolation, the homelessness rate, sexual or gender minority adults. Then we have information, several indicators on maternal and infant health, including birth rate, infant mortality rate, mothers who receive later no prenatal care, low birth weight, births to mothers under the age of 18 years. Then we have some different measures of morbidity that you can see, and we pointed out that we'll have some new ones in terms of electronic smoking, adults with kidney disease. So some of the ones you may be familiar with, adults with prediabetes. These are sort of indicators that have become new and more of interest in the time since the last report was done. And then we have some mortality data as well, and then oral health data. And in the end, we'll have the substance abuse and mental health hospitalization data will appear under here. One thing you might notice here is, again, you can see our icons, and you can see, for example, here, if we look at adults with no recent dental visit, it's 24.7% adults have no recent dental visit. This data was from 2018. It's about the same as the prior value, and the trend is downward, so that's good. You want people to have a dental visit. And you can see then the different comparisons will change depending on what you're looking at. So we're going to go scroll back up to the top of the page. And I just want to point out a couple quick more things to you too. First of all is our geography selector. As you go through here, you can select a different geography, and you can see, for example, we're looking at that population under the age of 18. It's the state of Hawaii compared to the US value, the prior value, and the trend. But let's say I'm interested in what's going on in Kauai County. If I click on there, then all of the data in the tracker updates to the data by Kauai County. So now we have the population under the age of 18, it's 21.7%. Compared to the Hawaii value, they're a little bit higher. They're still lower than the US value, about the same as the prior value, and they're also having a trend. Or let's say if I want to look at data by the primary care service area, if I'm interested in looking at data for Hilo, for example, then now again, they will reshuffle. And so you can see that now we have the data for the population under the age of 18 for Hilo it's 20.2%. And that's our mean time period right now is the 14 through 18. You can see this is how it compares to Hawaii County, to Hawaii, then to the US, then the prior value, and then the trend. In this case, it's not a significant trend. So just to let you know that as you select your different geographies, your comparisons will all update as well. So it's kind of a neat way, whereas in the previous report, you could look at the data by indicator. This is one way to look at really the status of what your specific primary care service, the health in your primary care service area is. Another quick thing I just wanted to point out to you is if you're not a big fan of the list, you can click on the tile and you can see the data this way. And again, you can save these cards and send them to people and do things. If the red and green arrows are not working for you, if you've got issues with color blindness, then we also have a colorblind mode. So if you go ahead and you click that on, then you would see that here, if you can see green and red, you would see that it's a green arrow and it's down. And then we also have a little, but that's a good thing. So a thumbs up. So if you can't see that, then you see the thumbs up and you know that that's what that's for. So you have the ability to look at it as a couple of different little features that you can turn on and off to make it a little bit easier for you to cater it to how you want to see information. All right, so now let's go ahead and take a look at one of the indicators. Let's start with the population that's Korean, because that's a new indicator for this report or this tracker. And this will bring you to our standard indicator for layout for Hawaii Health Matters. So for every indicator, first you'll have what the indicator is, its title. So this is population that's Korean. You'll have the geography. So here you can see that we're looking at the population that's Korean in Hilo. I can also go ahead and look at the population that's Korean present in the state, Hawaii. So I'll just go ahead and take it to state now just for you can see. So now this is the data for the state of Hawaii. You have the measurement period, and you'll see here that we do have data from previous 5-year aggregates so that you can roll through the data and look at it across years. Then we'll have the definition. So this is an indicator, shows the percentage of the population that is any part Korean. So if you answered Korean and something else, if you're familiar with that terminology alone or in combination, that's what we're talking about here. We try to use plain language, any part Korean. And then why is that important? And so you can see here for the state of Hawaii, for 2014 to 2018, 5.2% of the population is any part Korean. That data comes from the American Community Survey. It's provided to us by the Conduit Healthy Communities Institute. It was last updated just this month. And we can compare that to the US value. In the United States, 8.5% of the population is any part Korean. So we're lower than them. We're about the same as our own prior value. And there is an upward trend. So you can sort of see that here as well. With the maps and graphs in Hawaii Health Matters, you can click, if you hover over and you click on the little icon there, you can export and save and use these to put them anywhere that you like. You can also download the CSV data if you'd like to be able to manipulate it yourself. There are some limited ways to customize the chart so you can show your confidence intervals if you like. You can also enable the zero-based access so you can really see that it's not that much. You can hide both of those too. And however you configure your chart, that is how it will download when you click one of the download buttons. Okay, so scrolling down here, you can see that this data is available. This is the state data. It's available by county. So you get a little map and information of what it looks like by county, and it's also available by the primary care service area. When you see these 3 visualizations regarding the data, first thing to know is that they're all interconnected. So for example, if I hover here over Molokai, then I get the data for Molokai. So 1.3% of the population of Molokai is any part Korean. And again, you get the confidence intervals and so forth. And you'll see also in the bar graph adjacent to it, it highlights where that is in the bar graph. And it also highlights the data in the chart below. So it's nice that you get to see all of this in one place. Also, then, as we mentioned with these before, you can then customize and play with these a little bit. So I can make my map a little bit bigger. I can zoom in on areas if I like. I can add labels off and on. There's some different things you can do with, doing the geography behind it and so forth. But again, if I like it, then I can click export and export the map to be able to use that if I want to use it in a different presentation or so forth. That is available to you. If I am looking here and I say, well, what is this? Which one is the highest? I hit here and I say, oh, it's South Kona. Where is South Kona? There it is. So you get your little geography lesson and everything all in one place. And again, same thing here. You can go through and we have the different options to be able to download this, this piece of the information, add your confidence intervals if you like. So you can see that, yes, it is the highest, but look at that confidence interval. So that may be something to keep in mind, that the numbers are so rare that it's somewhere between 3.2 and 23.2. So know that that's a very large confidence interval. So sometimes this is really, it can be helpful to turn these off and on, but sometimes they're confusing to people. So we allow you that option to look at them. So again, if you like all this data, you can also go through and you can download it here as well. One of the neat things about the map is that we have the ability, or this whole feature is you have the ability to, again, that viewing the data in context. These are currently grouped by breakpoints between the 5 breakpoints, natural breakpoints between the distribution of this data. But let's say I'm really interested in Honolulu County. So I can go ahead and say, okay, let me see it by the Honolulu County value. Honolulu County value is 5.8%. And now I can see that all of the bars that are in the blue tones, the gray tones are not applicable. I can see in Honolulu County, where is a larger percent of the population that's part Korean. And I can see that, oh, here it's Ala Moana, Nu'uanu. So I can compare it by county pretty quickly and look at, so I can see my counties. I can compare it to the Hawaii state value. I can compare it to the US value. I can also take a look and say, well, is this changing over time? And I can compare it to the prior value. So here you can see that all of these are about the same. So there's no significant change. So we don't have like this booming part Korean population anywhere. I can also take a look at the trend over time. But over time, I can see where the population of part Korean is significantly decreasing. It's decreasing, but not significantly, no change, increasing, or significantly increasing. So you have just some abilities really quick here to be able to sort of play around and get more information, more context with which to interpret this one piece of data. Okay, the last thing I just want to show you, as you see here, is that at the end, you'll have this information that says there are 35 primary care service area values. The lowest is 0.3, so it gives you the range. It tells you where the half are between here and what the median is. So just to get a little more information. And as in Hawaii Health Matters and all of our indicators, then they are presented with another constellation of indicators, reports, data resources, and CDC resources that may be helpful for you, that may be another something that you want to explore. So we'll go back to the actual tracker. And let's go ahead and take a look at a piece of health data. So I was going to look at adults with a usual source of health care. So we'll go ahead and click here. So again, taking a look at it. If you think about each indicator, I like to think them as a book. And then you pull it off the shelf and then you go through it. But this is sort of the spine of the book, and it lets you know that 85% of adults in Hawaii say they have a usual source of health care. We are higher than the median value for states and territories, about the same as our prior value. It's a positive trend, and that's a good thing. And then also one of the things that we have in, again, with data in context, is that this indicator is an important information for the physical activity and nutrition plan. They've set a target for it and it's been met. So that's why it's a positive check. It was also a Healthy People 2020 goal, and the state exceeded that target. So that's met there. So if I go ahead and click on this one, that here we can go through and you can actually dig down into the data. So we see adults with the usual source of health care, that information that we had before, but we also have subgroup level information at the state and the county level so that you can then see who doesn't have a usual source of health care. And again, with red being bad and green being good and blue being neutral, so younger adults are less likely than the population as a whole to have a usual source of health care. As are people with lower education. So we have the ninth no diploma and high school diploma only. And we can look at people who are unemployed. So it kind of gives you men, it kind of gives you an ability to say, if I was going to target, which area that I would target. And again, we can scroll down here and then look at our primary care service area data. And you can now see then what it looks like across our primary care service areas. If you're very interested in a piece of data, so let's say I want to take a look here and see what things look like here in Ka'u, I can also click on that, and that brings me to a report specifically for Ka'u, and then I can see what it looks like compared to Hawaii County, compared to the Hawaii value, and then these targets appear because it's a ongoing thing. And then it looks up in here, you get all the additional information regarding how we compare to the rest of the primary care service areas. If you scroll down on this, you'll see that there are only 34 primary care service areas here, and that's because for one of the primary care service areas, there was not information available that was statistically valid. So either the denominator was too small, or in this case, the relative standard error was too big. And when the data does not meet those criteria, instead of saying not applicable, they just get dropped from the chart. And if you scroll back up to the chart, I looked at this one. I believe it is for Lanai is the one that's missing the data for that one. So just to give you that little information. Okay, so I just want to, any questions at this point?
Yes. Is the data disaggregated for Micronesian and Marshallese populations?
It is not. Right now, the state of Hawaii does not collect data at that level of disaggregation. So we have the ability with BRFSS to look at other Pacific Islanders, and also with Urbis data and our birth data, death data. Pretty much all of those have the ability to look at other Pacific Islanders, but they do not disaggregate further than that. So your question is to find out which primary care service areas have the highest and lowest proportions of adults with kidney disease. And then the next question is, how do they compare? And that should be a do, not a to, sorry about that, to their respective counties. And then is that data available for all primary care service areas? And is more granular data available? So going through with the primary care needs assessment tracker, I scrolled down to adults with kidney disease, so you can see that it's 2.9% for all adults in Hawaii. And clicking on here, and you can see then we're going to get some more information about adults with kidney disease. You can kind of see it over time. You can look and see what the high risk groups are. So they're going to be the older population. In this case, looking for primary care service areas. Now you can see lowest is going to be Ewa Kala'eloa here, and the highest is going to be Waianae at 5.5%. So it goes from 2.5 to 5.5%. If I didn't want to do here, I can also just say, oh, this is the lowest. It's also that same in Puna. So it's the same for Puna. I can go ahead and search it, go ahead and reorganize it, sort it, and see it's 5.5 for Waianae, right? And then the next question is how do they compare to their respective counties? So if you go ahead and click Honolulu County, then you can see Honolulu County is 3.4%. So you can see that in Ewa, it's about a full percentage point lower, and in Waianae, it's almost 2 full percentage point higher in terms of percentage of adults with kidney disease. And then the next question was, is this data available for all PCSAs or primary care service areas? So one you can see here, if we go ahead and get rid of this, you can see that there are some that are not colored in, so that gives you a clue. But you can scroll down here to the bottom and you can see that this data is available for 25 primary care service areas. So what happens is even though we put 5 years together of data, either there weren't enough respondents in that area, or because kidney disease, more really what it is kidney disease is pretty rare. So when you look at it from year to year across those 5 years, the estimates varied pretty dramatically. So the relative standard error was greater than 0.3. So therefore that data is not displayed. So then that gives you that. And then the next thing, the bonus there is this data available at a more granular level? And I didn't go through this too much, but yes, it is. This is one of those pieces of data that's actually available. We created the primary care service area layer for you to look at, but this is available through the CDC places study all the way down to the zip code area and the census tract. And you'll see here that they are not missing zip codes because they're using a different, more complex statistical methodology that's especially designed to weight the existing data for zip code, but we have 28 indicators actually in Hawaii Health Matters that have data all the way down to the zip code level. So here you can see, when you look at by zip code, the lowest is 0.7, and that is this little tiny zip code. Here you can see it up here in Oahu, right in there. And as high up as here is 4.4 when you look at it by zip code, and that's in Molokai. It is also available all the way down to the census tract level. So this is one of these other kind of advantages of having this report be automated, is that you can really get into and really dig down into the deeper levels. Thank you for attending. We'll be doing our next webinar on May 4th at 11 a.m. So we always do it the first Tuesday of each month, and that's going to be on the 2019 behavior risk factor surveillance data in IBIS. And for our June webinar, we're going to be doing social determinants of health information in the Hawaii Health Matters, because one of the nice things about that website is that it has data that's not directly in the warehouse, so we have a lot of extra background information there.